Aloha, it's Wednesday. Welcome to Maui Nonprofit Notes. We're here each week talking story with Maui nonprofit executive directors and their staff to find out how they're working to support those with needs within our community. Maui Nonprofit Notes is generously sponsored by Pacific Source. If you're building or remodeling a home, please stop by Pacific Source's Cabinet and Appliance Showroom located in the Waikapu Base Yard. I'm Susie Tiemann, Executive Director of Lokahi Pacific, and your host for Maui Nonprofit Notes. For those of you who may be listening for the first time to this weekly show, during this hour we'll share some of the experiences of our nonprofit agencies and just how they're changing lives, changing communities, and creating miracles of hope for those with needs. Today on the show we have a pretty brand new member of the Maui Nonprofit Directors Association, the Beata Home Health Care Organization. And we've got Eliza Lip, who is, the Maui
Director.
Maui Director. That sounds like a good title to me. Okay. And she's going to be talking about the different services they provide and how they can help folks. Again, we always talk about the needs that are out there. Give us a little background on Beata. I know it's a fairly good-sized organization across the country. But you're in Maui. Are you on the other islands too?
Yes. Hi, Susie.
I'm sorry. Hi, Eliza.
Thanks for having us today. So Beata is nationwide. We have over 300 offices. In the state of Hawaii, we are on all of the islands. We have specialty offices, so different offices for behavioral health, habilitation, assistive care, pediatrics, and adult nursing. And we have them on Oahu, Big Island, Kauai, and Maui.
Cool. And the Maui office has been open since?
The Maui office has been open since 2012, and we transitioned from a for-profit Beata Home Health Care to a non-profit Beata Home Care in July of 2015.
Okay. And I'm sure there was a good reason for that, and we're not going to get into all those details for people. But the Beata Home Care.
Yes.
Okay. Itself here on Maui has a couple different offices.
Correct.
Doing different types of services. And those would be?
So on Maui, I oversee the Maui Behavioral Health Office, where we provide instructional support services through a contract that we have with the Department of Education. We provide one-on-one services with paraprofessionals who work directly with the student on their individualized education plan goals, so their IEP goals. We also provide services through applied behavior analysis, which is brand new in the state of Hawaii. We were the 42nd state, yay Hawaii, we got there, to have applied behavior analysis covered through the medical health plans for children with a primary diagnosis of autism.
Let's just stop right there and go a little into detail as to what these services are, because these are probably some new terms to a lot of people out there.
Yes, absolutely. So for applied behavior analysis, this is a service that is now covered through Medicaid health plans as well as commercial health plans. And anyone who has a primary diagnosis of autism spectrum disorder, who is either under the age of 21 for Medicaid and under the age of 14 for commercial insurance, qualifies for their health plan to cover home and community-based services through applied behavior analysis. And those services focus on specialized areas that a licensed behavior analyst, which is also brand new to the state of Hawaii, that was effective, the licensure law, January 1st of this year.
This year, wow.
So many new things. And they focus on toilet training, feeding concerns, gross and fine motor skills, sensory issues, challenging behaviors, activities of daily living skills. And the licensed behavior analyst oversees the program, and what's called a registered behavior technician is the person who's working directly with the client in their home or in the community.
Wow. We've taken all this to a whole nother level. Yeah.
Yes.
I mean, it used to just be, oh, he's a little slow and for his potty training.
Right.
But there are some issues that can cause that. It's not just a little slow. There's something going on, and we need to find out what it is.
Exactly. We also provide parent and family training, and so we want to make sure that we're working with the family. So when our employees are not there, the methods and goals that are being implemented are being carried out after our services. And so the earlier that we can provide services to children with a diagnosis of autism, the more progress that we find. And so we really try to get the word out to the community, to doctors' offices, to the police station, to the clinics, as well as the families, that these services are now available, as well as covered by health insurance.
Well, that's terrific. That's terrific. So I'm trying to catch up with all the things you said. It's like, wow. Okay, so that's under your applied behavioral analysis program. Okay. And now, would a doctor tell a family they need this, or would the family come to you directly, or how?
Typically, any type of specialist, so it could be a pediatrician, a psychologist, a psychiatrist, they can refer a client to Beata or to an agency that provides applied behavior analysis. And now with the licensure law, with behavior analysts being licensed, they're able to sign off on the assessments. And the assessments could be anywhere, they're extremely comprehensive. They could be anywhere from 25 pages to 55, 65 pages. And so what was happening in the past, we'd send these comprehensive behavior identification assessments back to the pediatrician to sign off on. And it was not appropriate. So now the licensed behavior analyst can sign off on them themselves, and we can submit them to the health plan for ongoing treatment.
I see. So the pediatrician really doesn't have time to work individually with these people.
Right. It's very specialized, the service. And so the initial referral, though, can come from the pediatrician or from any specialist. Any family who is thinking they may benefit from this service, or might have a family member or a friend who they think may benefit, who's listening, the requirements are the individual does have to have a primary diagnosis of autism, and that has to be documented. So when we submit a request to a health plan, we do have to submit paperwork showing from a doctor that they have been diagnosed.
I see. Now, how how early might a child be diagnosed with autism? How early are they showing signs of it? Well,
right now what we're seeing with the referrals that are coming in, there's an early intervention program as well. And so they could be diagnosed as early as 2-3 years old. But again, the earlier they're diagnosed and the sooner they're set up with services, the better there are for results.
The outcomes.
But there are sometimes where they're not diagnosed until after 3 years old.
I see. Now, the pediatrician can diagnose the issue, but doesn't have the special training or education to work with them like the behavioral analysis person does.
Right. So the behavior analyst, they have gone through leaps and bounds and hoops and many hula hoops. I'm not a behavior analyst. I'm a licensed clinical social worker is my background. But the behavior analysts, they go through a significant amount of schooling. They have to have practicum hours, they have to have supervision hours, and then they have to take a licensing exam. They are also the ones responsible for certifying the registered behavior technicians, which is now a national accreditation. And anyone who's working directly with the clients is required to be a registered behavior technician. And that individual goes through 40 hours of training, a skills competency, And they also are taking a test at a Pearson's Testing Center, which right now in the state of Hawaii is only located in Oahu. So we're hoping, fingers crossed, by the end of this year to have one on Maui.
Really?
And so that's been something that, any individual, they can't just go through a few days of training. They have to go through that very specific process and be registered under the BACB guidelines, and it's, again, a nationwide accreditation.
Mm-hmm. Now, it seems to me, and I can't remember where I heard it, but the occurrence of autism is rising.
Yes.
And especially on Maui. But is that a nationwide thing that's going on, or?
I believe it's nationwide. Don't quote me on this.
Okay.
Haven't personally done research, but it is, 1 in 68 children are diagnosed with autism. I'm not sure if it's because there's more awareness and education in the state of Hawaii. We do have some great community resources. We have HABA, Hawaii Association for Behavior Analysis. They're very involved in having these services approved to be covered by medical insurance, as well as working with the families and educating them on what their rights are and how to access services. There's also the Hawaii Disability Rights Center, and there's Autism Speaks, which raises awareness for autism, gets families in touch with different support groups, and also allows them to have access to services.
Wow, 1 in 68.
1 in 68, which is very, very prevalent. That's, I'm sure we all know more than 68 people.
I was going to say, I can think of a room full of people and go, there's got to be, there's one related here somewhere. But you could be right, when you said it could be a matter of the awareness factor. Like back when breast cancer was the topic. And then all of a sudden the numbers started rising. Well, it was because they had new systems to detect it. And you could get treatment earlier, save more lives. And for autism, it's something, their future.
Right.
It gives them a future, I guess, is one way you could put it.
Absolutely. And for applied behavior analysis, the services, they're authorized, at a maximum of only 6 months at a time. So the goal is that the child will not need to have the amount of services stay the same throughout the duration of their life, and that as we work on goals and reach those goals, the hours that are medically necessary, become less and less because they have achieved goals, they're more independent, and we want to make sure that if they're not medically necessary, then we're no longer providing such intensive services. And Susie, the services for applied behavior analysis are right now specific to autism. And so if a child or an adult has a developmental intellectual disability and is not diagnosed with autism, there are many other services available in the state of Hawaii, and not only through the Department of Education, but also through Medicaid waiver services. And one of our other specialty service lines with Beata is our rehabilitation service line, where we're providing home and community-based services to both children and adults with developmental intellectual disabilities. And so really working on individualized goals and working towards independence. And some of the clients may have goals on supportive employment, community goals, activities of daily living, so bathing, toileting. It really is very specific to that individual.
I see. And that, is there an age group, or is that the whole realm?
The whole realm. We have some clients that are 7, 8 years old, and some clients that are in their 50s or 60s.
Really?
And so, the great part of that service is that once they reach 14 or 21 years old, they still qualify for services, and that's covered by Medicaid through the Medicaid waiver bucket.
Okay. One of our other nonprofit organizations, Kalimo Maui.
Yes.
That's their whole focus, is working with people with developmental disabilities, and hiring them and getting them hired out in the community to work at whatever jobs they can, so they can become more independent. I would assume that you'd be working with them at some point.
Definitely. And we do have some of our clients may actually receive services through multiple agencies. So they may receive services through or Kalima, sorry, or through a different agency, and then also through Beata for parts to work on other goals.
Gotcha. Okay. On that note, we're going to take a short break, and we'll be right back.
Aloha from Pacific Source, and thank you for your support over the years. Pacific Source has offered more of what builders and homeowners value most in building materials and cabinet design. We've done this by offering superior customer service and products, as well as by designing kitchens and baths that are intelligent and elegant while staying true to your vision and budget. Visit our showroom in Waikapu in central Maui, where we display a variety of cabinets as well as top-name appliances like Sub-Zero, Wolf, Viking, KitchenAid, and more. We display countertops, tile and wood flooring, and several brands of windows and doors, including Fleetwood multi-slides and La Cantina folding doors. Come in and talk to our designers about making your dreams become a reality. From concept to completion, we really believe our attention to detail and superior service are what sets us apart. Let us show you what we mean. We are a Pacific Source at 515 East Oahe Way in the Consolidated Base Yard in Waikapu, just off Waiko Road. Call us at 986-0380. That's 986-0380, or look us up online at packsource.com.
And we are back. This is Maui Nonprofit Notes, the weekly radio show where we talk story with our nonprofit executive directors and find out what they are doing to help those with needs within our community. Today we're talking with Eliza Lip, who is the Maui director for Beata Home Health Care. One of the things that I know a lot of people say, there's not enough places for people to be able to go when they need help. There's no facilities where they could live, things like that. And that's what makes an organization like yours so important to the community, because you provide the services, like some of them are in the school, but a lot of them are at home.
Right. Many of the services are in the home. Some of them are in the home and the community. And we spoke briefly before about the habilitation and behavioral health service lines. We also have a sister office with Beata, which is located in Wailuku, and they provide assistive care services, adult nursing, pediatrics, home health, and they contract with the different managed Medicaid plans as well as commercial plans, and they provide services in the home as well as the community to try to keep people home, to try to prevent them from having to go to a nursing home, a group home, or the hospital.
So just briefly kind of touching base on these other four items. Home health, that is your short-term nursing home kind of situation at home.
Correct. So any type of intermittent services, it could be anything from speech therapy, physical therapy, occupational therapy, social work, nursing, any type of skilled service that if an individual is discharged from the hospital, they may qualify for home health. And it's to prevent them from being readmitted to the hospital. Many times we will work with the families and the client to teach them the appropriate ways on how to take care of themselves.
Okay. And then in talking about adult nursing, what are we looking at there? Obviously we're talking about seniors.
And that could be anything from medication to providing glucose, administering shots. And so that could also be covered through Medicare as well as Medicaid. And in order for us to administer medications, then a registered nurse is required. And so the skilled nursing services, that's could be specific to adults, but there are children that receive nursing services as well. And with Beata, the nurses that go out to these homes, if they're working with an adult, they're trained specifically to work with adults. If they are working with children, then they would require to have additional training and experience specific with nursing with children.
Interesting. Okay, so everything is a particular educational focus. I mean, there's no general person who's going to go out and do all three of these or four of these. You're going to have somebody who specifically has been trained to do what is needed in your case.
Exactly. And Beata believes in different specialty practices. So this way you have training, initial training, ongoing training in that specific service that you are providing. And so there are, although we are all called Beata, there's multiple Beata offices on the island of Maui as well as the other islands in the state of Hawaii, and they specialize in that specific area.
I see. That's interesting. So one of the others that you mentioned was assistive care. Now this is one I guess that a lot of us are more familiar with in helping. Well, it doesn't have to be seniors particularly, but people who need household things done.
Right, and this could be anything from a chore worker to a companion to a home health aide. A home health aide would be somebody who would go in and provide hands-on care, so they would help somebody with bathing, toileting, any type of grooming. And a companion or a chore worker, they may go in and help the individual with their laundry, meal preparation. Again, it all goes back to how can we keep individuals living in their home and out of facilities, as well as being independent and promoting quality of life.
I see. Now, when you start talking about that, you're looking at like the cost of staying at home or the cost of moving into a facility. And we all hear what the prices of those are. I mean, they're outrageous. But if you've got a home that's paid for, and basically it's the upkeep on that home, and say your Social Security pays enough for you to keep that home, this is a service that can be provided by your insurance to help keep you in your home and keep you safe.
Correct. The assistive care office with Beata has contracts with the different managed Medicaid health plans. They also have a contract with Kapuna Care. So individuals who do not have Medicaid, they may qualify for home care services through the Kapuna Care program, as well as we partner quite a bit with Neighbors Helping Neighbors. They have a volunteer program. It's not set up necessarily to provide ongoing, every other day they're in the individual's home,
right.
But they have some amazing volunteers, and they really have connections and build rapport with these clients who are living in their home. Maybe they don't have family left on Maui, and so the volunteer agencies, as well as the agencies that are contracted by the health plans, can work together and allow the individual to stay in their home and not be a danger to themselves, not leave the oven on.
Right.
Or fall because they're trying to do laundry on their own.
Gotcha. Okay. And then we kind of jump backwards to pediatrics.
With pediatrics, we provide services again in the schools as well as the homes, and so that could be anything with G-tube feedings, any child that is considered medically fragile that needs a skilled service, and so a nurse would be trained specifically to work with children. A child who requires a nurse who's 4 years old is going to be very different than somebody who is 64 or 74 years old, and so we want to make sure that the individual going to the home, they know what they're doing, they've been trained, and again, there's quite a bit of ongoing trainings that Beata provides and requires of all their employees.
It's mind-boggling to me, all the different areas that you cover, and obviously all areas are needed. I mean, there's people here that maybe trying to do things on their own, and maybe they think it's going to cost too much to ask somebody for service. But we're talking about something that, for the most part, can be covered by some insurance of one kind or another.
And we try very hard to work with the families who call Beata and are looking for services to help them explore all of their options in regards to, okay, if they don't have Medicaid, they don't qualify for Medicaid, what are some other areas that may cover these services, and where can we give them community resources to and work together as a community? You know, Maui is very unique because there's such a feeling of camaraderie and wanting to pull together to work for what's going to benefit that individual and not view it as competition. And so we want to make sure if we're not able to provide a specific service that's going to be best for that individual, then we want to point them in the right direction to the agency or community resource that can provide that service or that can cover that service.
Right. Now, I'm as I'm listening to all these different specialties, you obviously have a lot of people who work part-time.
Yes.
That it's for a lot of people who have been trained in these various fields. This has got to be the greatest thing that ever happened to them, to have an office like this that needs their services and yet kind of can pick time and place where they're going to work, when they're going to work. And yet it benefits you because now you've got someone who can do that specialty. How many employees are we talking about altogether?
I would say
On
in
Maui.
Maui, there's probably about 300 employees, and
My
we
goodness.
are constantly hiring. If anyone's looking for a job, and it's very flexible. Some employees work 4 hours a week. Some employees work 32 to 40 hours a week. It is all part-time, and it's dependent on what schedule is going to be best for the client. The clients are going to come first in regards to what their needs are. And when we do have new employees or ongoing staff, we make sure that not only does it work based on the schedules, but that it's a good fit. You know, we're going into your home, we're providing very personal service. And so we try to have a meet and greet set up before we send an employee in on their own to provide the service. And this way the client can meet the employee, ask questions, get to know them, and then we'll send the employee in to actually go and provide ongoing services.
Wow, that's wonderful. That's wonderful. And of course, they've all been through all the various checks that
yes,
you have
all
to
the
do.
trainings. There's, and again, specific to what their position
Right.
is and what service line and what the need of the client is will determine what trainings they'll have to go through before they can work in the field.
That's great. Now, are you new with Beata?
No, I've been with Beata for about 5 years now.
Okay.
And the behavioral health specialty with our instructional support service line with DOE is not new, but the ABA services to Beata is relatively new due to the licensure laws
Right.
and Luke's Law and everything passing. And so that service for the state of Hawaii is
Right.
pretty new.
So you were here in Hawaii for Beata, or were you?
Yes, I've
Okay.
been in Hawaii for about 9 years now.
Okay.
I'm hoping now I can call it my home.
This is home. And if you started out on Oahu, I'm sure you're thinking Maui is the home part. Why do
Yes.
we always say that?
I
There's something about Oahu. I'm sorry. I've got to go there not next week, but the week after for a day, and I'm already trying to figure out how to cancel.
I know that's the best part of flying back home. It's like you get to call this home.
Yes, that's true. You get on the plane in the morning to go over there, and you can't wait to get on the plane to come home.
Exactly.
Yeah,
Exactly.
we put up with it for a day. Well, this has been just absolutely, I want to say fascinating, but it is, because I never dreamt that there was this type of service out there that was so specific to the needs of our people. How can someone reach your office? And I'm sure that if your office isn't the one that handles what they need, you'll pass them on to the other office. But what's the number for you?
So the number for Beata is 244-6879. And we are located in Kahului, 427 Alamakani Street in Suite 200. And we have the behavioral health and the habilitation offices are located in Kahului. And if anyone is interested in receiving services, learning more about services or employment, then please give us a call. We can also refer you to the home care service lines as well if that's the area of services that you need or that you are looking for employment for. We can definitely point you in the right direction.
Well, it sounds like you've got one of those employment plans that suits everybody. Depending on what your specialty is, and of course, anyone who's been trained in these specific fields, there's got to be a point at which they say, "Well, I'm on Maui. What am I going to do with it?"
Right.
Or I don't want to move to Maui because I don't see, there's no need for it. I don't see anything listed anywhere. Well, here you are, and we can schedule your time the way you want it and how it works with the client that needs to be served.
Definitely. Please give us a call. We have 2 full-time recruiting managers, and there are more and more clients that are in need of services, and so we would love for, if you're listening, for you to come and join our team and be part of a team of professionals who wants to help people and help them promote independence and have a high quality of life.
And the organization, even though it's fairly new to Maui, is not a new organization. The founder, Mark Beata, started it in 1975, I was reading.
Yes.
So everybody's learned a lot in those, 40 years? Is that 41. Good? Is that good math? Okay. All right, close enough. 41 years.
And Mark Beata started out as a home health aide, working in the homes, providing services himself, and thought, this is an area that I really want to invest my life in, and that there's a need for compassionate, excellent, reliable employees, and that we can really make a difference in people's lives.
Well, that I think when you said compassionate, that's number one. There's a job, and then there's a career, and then there's this, which is a life,
right?
Which is helping someone else with their life and bettering their life, which is whether it's the family or the individual.
It definitely takes
really
a special, unique person to work in the field and want to help others. We're going into their homes. We may not know what to expect when we first go into somebody's home. And so the compassion piece really does play a huge part.
True. Thank you, Eliza, for being with us today. I know you've got to rush back to a meeting, but we appreciate your joining us and talking story with us, and we'll have you on again a little later this year.
Great. Thank you so much, everybody.
Thank you for joining Maui Nonprofit Directors Association. Okay, we'll see you later, Eliza. It's break time. Okay.
Aloha from Pacific Source, and thank you for your support over the years. Pacific Source has offered more of what builders and homeowners value most in building materials and cabinet design. We've done this by offering superior customer service and products, as well as by designing kitchens and baths that are intelligent and elegant while staying true to your vision and budget. Visit our showroom in Waikapu in Central Maui, where we display a variety of cabinets as well as top-name appliances like Sub-Zero, Wolf, Viking, KitchenAid, and more. We display countertops, tile and wood flooring, and several brands of windows and doors, including Fleetwood multi-slides and La Cantina folding doors. Come in and talk to our designers about making your dreams become a reality. From concept to completion, we really believe our attention to detail and superior service are what sets us apart. Let us show you what we mean. We are a Pacific Source at 515 East Oahe Way in the Consolidated Base Yard in Waikapu, just off Waiko Road. Call us at 986-0380. That's 986-0380, or look us up online at packsource.com.
And we are back. It's about 20 to 1, and we're kind of in the same boat we were last week, where all of a sudden we only had one person coming on, and Eliza had a meeting with some folks from their Oahu office that she couldn't get out of and go too late. So we're gonna fill in here, Gary. You and I.
Okay.
Should I interview you, or you want to interview me?
Neither.
You
just talk.
Oh, I should just talk. You folks out there are gonna get sick and tired of hearing me talk. But it's my favorite subject, Lokahi Pacific, and what we do. Last week we talked about our what did we talk about? How good's our memory? What did we talk about last week? We talked about the Pono Center.
Oh, right.
See how quickly we forget. 62 Market Street, the Pono Center up on next to EAL Theater. We had an incident over there last night that I'm just going to mention on the air because I think that we need to be vigilant. We know that there's Wailuku has an element about it that we seem to gather some interesting people up there, especially overnight. And we've got this huge parking lot behind our building, which has signs all over it, no overnight parking. We've made the calls. We have a tow company that can come in and pull the cars out of there. But last night we had someone who tried to start a fire in the back lot. And, you know, I just don't understand why someone would do such a thing. They were not smart about how they tried to start it because it didn't get going. It just made enough smoke to wake up some of the residents in the building, who quickly called the fire department, got them over there, and got it put out. But why is the question? And it's not that something caught fire. As everybody was reviewing it this morning in the light of day, it definitely was some stuff piled to create a mass that would start fire and would spread. We have wood chips along the edge of the driveway down there in the parking lot, and not that they burned. I mean, they're certainly dry enough that they could, but it didn't get a hold and take hold. But it was in the area of our gas tank, the propane tank. And it's like if they had built the fire 2 feet in any direction from where they actually did it, it could have been very messy, very nasty. And so I'm bringing this out. You know, I thought about it. Should I say something? Should I not? We don't like to think about things like this happening, but here it is. It's in front of us, and I think that everyone should be aware that this might be someone who's out there trying to create some problems. And so if you have a business in Wailuku, be on the lookout. If there's anything that gets left outside that could catch fire, perhaps that's what this person is looking for. But they didn't make enough noise to wake anybody. It was the smoke that woke somebody. So I'm sure the fire department is still investigating to see what's going on there. But it's one of those things. I guess there's two things in this world that scare me, and fire and water. You know, I mean, the oncoming rush of water during a sudden rainstorm that washes down EAL Valley or out at Seven Pools or wherever the case might be. You know, get out of the way. Don't go up there. If you know there's rain up in the mountains, stay out of those rivers and those waterways. If you know there's somebody out there playing with matches, lighting fires, don't give them anything to work with. But it's scary to have something like that happen. And so I'm putting it out there just for everybody to be aware, be alert. If you see somebody suspicious, you know, don't be afraid to make that phone call to the police department and let them know that something's going on that doesn't look right. There's some activity in that area where the EAL Theater is right next door, and then the city or the county was building kind of changing the format of the parking lot back there and putting in a cement slab on the street side, which I guess is going to at some point become a seating area or a park-like kind of place. But none of that has happened yet, so it's just kind of a hangout place at this point in time. So there's no lights in that area, but we have plenty of lights in our parking lot. And I'm surprised that somebody would try to do something because, you know, I don't know how to do anything like that, but I'd take one look around and see the lights and say, maybe they got cameras too, you know, and I'd run. But some people have the thrill of trying to do things like that. So I'm just putting it out there. And so those of you on Market Street, Main Street, in Wailuku. If it's a localized thing, we might see more of this. But please be vigilant and keep an eye out for your neighbor's property as well as your own. That's all I'm going to say about that. Not much else I can add.
Okay.
Right? That was a good question you asked me, Gary.
That's right.
You got another good question? What else do we do? Okay. That was still a continuation of the Pono Center at 62 Market Street. Lokahi Pacific, which is the organization that I'm the executive director for, provides housing for folks who are mentally challenged, physically challenged, low income. Gosh, what all do we have? You name it, we've got it. In our 7 apartment buildings, and it's, why can't I find it? There it is. There's the page. We have 2 buildings, 2 places over behind the hospital. There's 2 sets of complexes back in there for the chronically mentally ill. Behind our office building, we have transitional housing for those who are affected by domestic violence, for people with physical disabilities, and HIV/AIDS transitional people. In Kihei, we have an affordable rental property, and the Pono Center at 62 Market Street. Those people are also affordable rentals. And then out in Waihu Terrace, we have a property that's for the physically disabled. And that property, we just went through a major renovation in that property, and it's looking good. We have wait lists. I hate to say that. Wait lists for almost all of our properties, but that's the way things are today. And once people move into our properties, we very seldom have them leaving because they found something better. We have some people who've been in our buildings for 20 years.
Wow.
Isn't that something?
That's good.
But for many of these people, it's kind of the last place for them to live on their own independently. If not there, where is kind of the answer to that question. The other part of what we do build affordable housing. We don't go out and do 300 houses at a time like the big guys do. We've done 12 houses, 15 houses, 6 houses, and now this one that we're working on currently is 16 houses. This one is coming up in Mokuhau, which is right down here in Happy Valley off of Market Street on Mokuhau Road. We're set to break ground sometime shortly after August 1st. And I know everybody who's been coming in and applying for this housing is just going to be thrilled to finally see us breaking ground. But once you get into this and have to go through all the processes of getting permits and the different departments signing off on things, and it really is a challenge. And I know everybody's probably tired of hearing how difficult it is to even get an affordable housing project okayed by the county, and then to get into the various departments to get your plans approved. And now we're in a situation where the contractors are all getting busier and busier, and so we've been delayed another few months by having to wait for our contractor to finish a job and come over and work on ours. So that's why we're looking at shortly after August 1st for breaking ground. So I'm so excited about that. I don't know what else to say about it. It's like, oh my gosh, it's really going to happen. And I know that there's probably some people who thought, well, that project must have gone by the wayside. It hasn't. Let me tell you, there's 16 families out there that are just waiting for these houses to be built. And if you have not applied for one of the houses, the price range is going to be in the mid to upper 300,000s. And I know everybody keeps looking at that saying that can't be affordable. It truly can be. When you think of today's rents, if you've just recently had to rent a 3-bedroom home for your family, just a nice home, you're paying $2,000, $2,200 a month for that unit. Some may be lucky enough to be paying $1,900, but there's nobody paying much less.
And that's for like a 50-year-old home.
That's true. That's not a brand new.
No, yeah.
Yeah, a brand new house. I'm looking at a situation where I believe that somebody can get into one of these houses and have a monthly payment that includes taxes and insurance, which is going to be around $1,800 a month. And that sounds like a lot, but that's a fixed price. You know, you've got a 30-year mortgage. It's not going to change because somebody wants to make more money, or somebody sold the property and the new owner has to make more money because now he's got a bigger debt to pay. This is your house. So it's there. It's possible. The first 12 homes will go to the first 12 who qualify. And the qualifications, we've been going through that process for probably a year now. And some of those have been determined at this point. And that's the first 12 homes. The last 4 homes will be done by lottery. So if you haven't filled out an application and turned it in to us, please either call the office or email us at, you can send me an email, Susie@lokahipacific.org, and say, I need an application, I want to fill one out. We'll send it out to you. Or you can go to our website, which is lokahipacific.org, and download an application. Fill it out and get it back to us. And again, you may not be one of those 12 that has a specific house assigned to you, but you will go into the pool for the lottery of the last 4 houses. So there's always a chance. I personally don't ever win anything in a lottery or a giveaway of any kind. There could be 3 people in that envelope and I still wouldn't get a house. But I know that some of you are very lucky out there, and if you can get one of these houses, your luck is really good. We got to take a short break?
Yes.
Okay. I'll be right back.
Aloha from Pacific Source, and thank you for your support over the years. Pacific Source has offered more of what builders and homeowners value most in building materials and cabinet design. We've done this by offering superior customer service and products, as well as by designing kitchens and baths that are intelligent and elegant while staying true to your vision and budget. Visit our showroom in Waikapu in central Maui, where we display a variety of cabinets as well as top-name appliances like Sub-Zero, Wolf, Viking, KitchenAid, and more. We display countertops, tile and wood flooring, and several brands of windows and doors, including Fleetwood multi-slides and La Cantina folding doors. Come in and talk to our designers about making your dreams become a reality. From concept to completion, we really believe our attention to detail and superior service are what sets us apart. Let us show you what we mean. We are a Pacific Source at 515 East Oahe Way in the Consolidated Base Yard in Waikapu, just off Waiko Road. Call us at 986-0380. That's 986-0380, or look us up online at packsource.com.
Nakekio Emilia is a program for children and teens 3 to 18 grieving the death of a parent, brother, sister, Ohana member, or close friend. We provide peer support groups, not therapy, and all groups are free. We have openings now, and if you're interested, please call Dr. Brooke Brown at 214-9832 for information, or contact us through our website, nkoemaui.org. Aloha.
And we are back, and this is Maui Nonprofit Notes, the weekly radio show where we talk story with our executive directors of our Maui nonprofit agencies, and talk about what they're doing to help folks with needs and just you name it. And you never know when you tune into this show on Wednesday at noon who's going to be on and what we're going to be talking about. Earlier today we were talking with Beata, who is a home health care organization, and all the different services they provide. And I thought that was really interesting. I didn't know half that stuff. I mean, I knew we had people and
Right.
with those issues, but I had no idea that we had so many competent, educated people in those fields that could be out there helping one-on-one. And most of it covered by insurance of one kind or another. That's just fabulous. And to hear that they have 300 employees who work anywhere from 2 to 4 hours to 40 hours a week, that's a perfect job for a lot of people.
I'd like to work 4 hours a week.
Well, you probably want to be paid, though, like it's 40.
Right.
I know your type, Gary. I got you. And so we were just these couple weeks. I mean, last week, this week, and maybe next week, we run into a situation where we have people going on vacation or having to cover for vacations. Kids are out of school. Some of them are going to be going back to school early or headed out for college, and so parents are taking them places. And so we get last-minute cancellations, and so I'm just kind of filling in the time here this last, 10 minutes or so, talking about projects that we have at Lokahi Pacific. And I just want to reiterate the Mokuhau housing, the affordable housing. These are 3-bedroom, 2-bath homes, approximately 1,400 square foot under roof, including a 1-car garage. These are single-family homes. These are not townhouses. These are not condos. These are not... what's the two together?
Duplex.
That's it. I wanted to buy something,
right.
But they're duplexes. These are single-family homes with nice little yards to enjoy themselves, and it's a one-street in cul-de-sac kind of thing. Perfect for that family, the family with the small children. So contact us and find out more about it. I want to thank everybody for joining us today. As we've said before many times, Maui Nonprofit Notes is sponsored as a community service by Pacific Source, the builder's choice. Please give Paul and his staff a call at 986-0380 or stop by their showroom in the Waikapu Base Yard on East Oahe Way, just off Waiko Road, to see how they can help you with your building project. The Maui Nonprofit Directors Association's mission is to provide personal and professional support to nonprofit executive directors, their organizations, and the community of Maui. Please visit our website at mauinonprofit.org for a list of member agencies. And if you see an agency there that you'd like more information on, please click on that item and it'll take you to their website so that you can find out more about them. Today we visited with Liza. Why do I want... You got it. Why don't I have it? Eliza,
there you go.
Yeah, Eliza. I knew that wasn't right. Eliza Lip. It wasn't LL. It was EL. And talking about the Beata Home Health Services. Her number is 244-6879. Please give her a call if you have any questions about their services, or pass it on to someone else that you might know of who maybe has a child or an adult in the family that could use their services. Want to thank you all for tuning in. Don't forget to join us again next week, right here, Wednesday at noon on KAOI Radio, 1110 AM, 96.7 FM, 96.5 FM on the west side, when we'll be featuring representatives from 2 other member agencies of the Maui Nonprofit Directors Association. Until then, I'm Susie Tiemann, Executive Director of Lokahi Pacific, and your host for Maui Nonprofit Notes. And I'm going to go off the air just a little early and let you listen to the music. Relax, enjoy yourself, and thank you for joining us today. Have a great week, everybody. See you next week. Aloha.